When someone goes to a hospital, we all intuitively know the doctor matters. Their experience, their specialty, their seniority. But here's what nobody talks about. It's never just one doctor. There is a whole team, surgeons, nurses, pharmacists, residents. And the question I want to ask today is, can AI look at the composition of that entire team and predict whether a patient will recover? Now look at these two patients. Patient A had four people treating them, a senior surgeon, an ICU nurse, a physician, a pharmacist. They recovered. Patient B had one intern. They did not. Now here is the problem. If I want to train a standard machine learning model on this, it immediately breaks because patient A has 4 rows of data and patient B has one. Every single patient has a different team size. Standard ML needs a fixed size input, same number of columns every row. This variable group size is the core challenge and most people just ignore it or pad the data badly. The fix is actually elegant. Three steps. First, take each team member and represent them as a vector of numbers. Their role, their specialty, their seniority level, all encoded numerically. Second, just add all these vectors together, element by element, simple addition. Team of 2, team of 10, you always end up with one vector of the same size. That's it. That's the trick. And the beautiful thing about addition is its order invariant. Surgeon plus nurse equals nurse plus surgeon. The model doesn't care who joined the team first, just who was there. Now you have a fixed size representation of any team and a standard model can take it from there. And here is a bonus. The same model can flip the question around. Given a current team, which specialist should we add next to maximize recovery probability? You just try every candidate, see which addition pushes the prediction next, and and that's your recommendation. Here's what the output actually looks like. You have a current team, surgeon and nurses. Model says 64% recovery probability, not bad, but not great either. Now you ask, who should we add? The model tries every specialist in the database and comes back with a recommendation. Senior pharmacist from oncology. You add them, recovery probability jumps to 89%. That's the power of this approach. It's just not predictive, but also prescriptive. It tells you what to do next. You might wonder, what about the patient's condition? We handle that by adding a second input, diagnosis, severity, age, etc. Concatenate it with the team vector before prediction. Now recommendations are patient specific. The same idea applies anywhere you have a variable size group driving an outcome. A startup founding team and whether they raise funding, a project scored and whether they deliver on time, a portfolio of stocks and whether it beats the market. The group changes, the math stays the same. If you want the full Keras implementation, the embedding code and the embedding recommendation function, I will come up with one video on the same. Follow to get notified. Thank you.